Good afternoon, Black Professional ERG. February has been jam-packed with everything we love. It's our history, it's Black history. We have had a phenomenal month, even though we celebrate all year long. We've also participated in the Start With Your Heart initiative, Steps Challenge, and let's not forget, Go Red for Women campaign. Joining us today is Dr. Leilani Martin. Dr. Leilani holds a doctorate in nursing practice in healthcare leadership from Chamberlain University. She's also board certified family nurse practitioner. Dr. Leilani's also certified trainer for Cook Ross, exploring everyday bias for the healthcare professionals course. Dr. Martin's experience includes cardiac ICU, neurology, IV infusion therapy, aesthetics, and also primary care. Dr. Martin's interest includes discharge planning, advanced practice nurse role development, and also Dr. Martin is an associate professor for the graduate program in City University of New York. Thank you for taking the time today to speak with us on Black Heart Health. Welcome.
Thank you, and thank you for having me.
All right, so let's start with some numbers. African Americans are highly affected by obesity. According to the American Heart Association, among Blacks age 20 and older, 69% of men and also 82% of women are overweight or obese. How do you think this plays a part in heart health within our communities?
Yes, so the first thing I would like to do is let us define obesity. So obesity and overweight is calculated by something called the BMI. You take your weight in kilograms divided by your height in centimeters squared. And then they come up with a number that's called a BMI. So 18 to 25 is the normal range. Overweight is 25 to 30, and obesity starts at 30. So what happens is the extra weight that's there causes the heart to work harder, essentially, which causes it to be in overdrive. It also puts you at risk for hypertension, which is high blood pressure. And also because of the excess weight, it increases the LDL level, which is essentially fatty substances in your cardiovascular system. You're also at risk for diabetes, coronary artery disease, and stroke. So because of all of this, the obesity plays a part in the community's heart health because it does all these things that predispose you to different illnesses. And that really puts us at a disadvantage, and it increases the rate of mortality.
I see. So like you were saying, you were talking about blood pressure, and those are very important statistics. High blood pressure in African Americans is at its highest rate right now in the world. Like you said, it's also known as hypertension. Have you seen these results of this disease being a silent killer amongst your Black patients?
Unfortunately, I have. Absolutely. So the staggering thing about hypertension is that virtually you don't have any symptoms. So this is why it's known as the silent killer. Most individuals are walking around with elevated blood pressure way before the diagnosis is made. And also, to help us level set, let's just define what hypertension is. We hear a lot about it, but what does it actually look like? So if you look at your blood pressure, normal is the top number, 120, and the bottom number is 80. So 120 is considered your diastolic pressure. I'm sorry, your systolic pressure, and 80, the bottom number, is your diastolic pressure. So let's just remember 120 over 80 is the goal. Stage 1 hypertension is usually, start diagnosing that at 130 systolic and then to 139. And then the diastolic is 80 to 89. Stage 2 is 140 or above on the systolic and 90 above on the diastolic. Now, what's interesting there is you see that there was a narrow range there. So from 120 systolic to 140, we're talking about stage 2 hypertension. So most individuals, they don't know these numbers. So this is why it is so deadly. And then at 180, you're in hypertensive crisis. Now, why it's a silent killer is because while you're walking around with no visible symptoms, you start to have organ damage eventually from having these elevated blood pressure levels. So you start to end up with things when you see someone's diagnosed, they've already progressed, right? Where they could have kidney injury, they could have issues with their vision and other organs. So this is why it's a silent killer, because by the time the diagnosis has made, there's usually some kind of damage. So that's why it's important to know the numbers that you have to be within normal range.
Okay, that's definitely some good information. So after just thinking about this and thinking about, how I live my life and how I was raised, Dr. Martin, the big elephant in the room, though, and we are known for some good seasoned, touch the soul recipes. How do you suggest that we keep that taste and maintain a healthier lifestyle at the same time?
Jessica, this is a valid question. And full disclosure, my family is from the South, the deep South, Mississippi.
Yes.
So definitely. And we know that food plays a large part in our culture. It's there when we are sad, when we're happy, celebrations. So that's a valid question on how to still have that cultural influence, but also healthy. So what I suggest is this: you can always find a healthier alternative. And what I often tell my patients and other individuals is that eating healthy or making healthy habits, it is a journey, it is not a trip. So we're all busy today. So if you have to go to a fast food restaurant because you're hungry, when you're looking at the menu, instead of ordering all three things, you can just get the sandwich and maybe have water instead. Another thing you can do is, now we're living in the era where there's a lot of substitutions. So for instance, for me, instead of putting the ham hocks in my greens, I might use smoked turkey, which is full of flavor. I substitute the oils for olive oil or avocado oil, right? Also, you can do amazing things by having some meatless meals during the week, right? And also cutting down on the condiments, I find to be a big thing. The hot sauce, the ketchup, and taking in the dressings that you put on the salad. So those are ways to substitute. And again, you're going to start small. No one says you have to, because what's going to happen is, if you're not enjoying your food, it's going to be hard for you to adhere. So small changes and substitutions go a long way. And I really like how you talked about the steps challenges that you're having, because the American Heart Association recommends, on average, 30 minutes of exercise 5 times a week. So you still can enjoy life. It's just that you shouldn't have everything. You should make substitutions. And then cooking at home definitely helps, and really staying away from the high fat, saturated meals on a daily basis. And I recommend to go to the American Diabetes website, because they have excellent menus there for individuals who are not diabetic as well. So it's a good place to start to kind of learn what things you should eat, and cut out the sugary drinks. Water is really the way to go. And, you can have your drinks here and there, but it's just extra calories that add to obesity and weight gain.
Definitely. I know myself, it's a challenge, but we're getting there every day, right?
Absolutely.
Yes, those are some great suggestions. So I wanted to just talk about also some studies that might illustrate race could affect heart care for African Americans. Not just heart care, but actual equal medical attention in some cases as well. If you're feeling unsure about your diagnosis, what should we be doing?
Thank you for this question, Jessica, which can sometimes be uncomfortable, but honestly, the statistics are staggering, and the research shows over and over again that persons of color receive different care in medical settings due to a number of things, but especially bias. So, with that being said, the biggest you're your own biggest advocate, but knowing your numbers will help for you to advocate for yourself. So when you walk into the room, you at every appointment or through your physical, there's some basic things every year that you should keep up with. You should know your A1C level, which tells you your risk for diabetes. And those numbers are 5.7 to 6.4. You don't want that number to be over 5.6 because that's where you're getting into pre-diabetes. Then it's also important that you know what your HDL and LDL are. Most importantly, the LDL, because that is the bad cholesterol. The number for that is 100 or below is where you want it to be at. 100 to 129 is still good, but if you're going into the area that's over 130, you want to have some conversations or do lifestyle modifications such as diet and exercise. The blood pressure, again, 120 to 129 is the goal. So if you're in that range where you're in the 130 and 140, you should have those conversations. And if you're at 140 and above, it needs to be more serious in terms of making changes. And if there's going to be something that you and your medical professional can decide on as the plan of action to get that down. And then finally, the BMI, which is the body mass index. So again, with these numbers, there's a little variation depending on ethnicity, bone structure, things of that nature. But 25 to 30 is where you are starting to get into the overweight category. So in order to advocate for yourself, you need to have these numbers to say, I noticed at my last visit that my A1C was 5.8, and that's pre-diabetes. What are the steps that we're going to take to bring my number to normal? So what it is that we already know that when you enter the healthcare arena, unfortunately, there's already many factors at play. But when you have the words and the information, the data, you can then have a conversation and hold the medical professionals accountable because you're knowing and we're working on a plan. So that is the advice that I would give because we already know that we have lack of access to care. If you look at the neighborhoods, the foods are different in terms of what's healthy and what's not. You see more processed foods, chips, soda because they're cheaper, lack of access to medications, and then providers. And then again, just because of the way the education system is and how providers were educated under a lens of disparity, we already know that. So what I would say is really advocate for yourself. Every year at your physical, you want to make sure that those numbers are consistent. And if you do have any of these conditions, you want to make sure that you're there every 3 months following up. And then also what medications that are you on, because there are some that are better for persons of color, especially Black people, like the calcium channel blockers. So these are things, and you can educate yourself on, there's numerous websites, but the American College of Cardiology and the American Heart Association are great places to start.
Thank you so much for this conversation, Dr. Leilani. If you would like more information on this topic, or you are in need of a nurse practitioner, we'll have to add Dr. Leilani to our Green Book for you to look her up when you're in the New York City area. Thanks, everyone. Have a great afternoon.